that was the whole point of the early analysis, was to point out that these pandemics, if they emerge, are extremely expensive. And the best way to deal with them is not to wait till they hit your country, because by then it's too late. What you need to do is actually hit them at the source, which is poor countries with badly functioning healthcare systems. And foreign aid, foreign development assistance is absolutely critical. And in this world of national governments who are very nationalistic, that's the sort of funding that has been cut. And that's really exposed them to this sort of problem.
Infections of the coronavirus are tearing through Asia, Europe, and North America at an alarming rate. At the time of recording, nearly 110,000 people have come down with the virus that causes COVID-19 in 90 countries. Some 3,700 have lost their lives. My next guest has been studying pandemics since the outbreak of SARS. Using as a guide past pandemics such as the Hong Kong flu of 1968 and the Spanish flu of 1918, Warwick McKibbin, professor of economics at the Australian National University, said even in a mild scenario, where 10% of the world's population is infected, some 15 million people may die. The deaths will be concentrated in poor countries where health services may be easily overwhelmed. Indonesia, for example, could see more than 600,000 deaths. Some $5 trillion may be erased from global GDP as workers stay home and supply chains break down. Professor McKibbin's report was published by the Brookings Institute last week. He joined me from Canberra. Warwick, thank you so much for this.
Happy to do it.
Your work in 2003 helped establish the economic impact of the SARS outbreak. I think it was a deficit or an impact of $40 billion or so. Is that right?
That's correct, yes.
But the world has moved on since then. I was wondering if you can explain the differences and how that was included in your study.
Well, what we did was we broke the shock to the global economy down into subcomponents, because we were modelling quite a complex set of behavioural changes. So the first thing was to work out what the scale of an epidemiological shock might be, and then translate it into shocks to households, people changing what they spent, what they purchased, shocks to firms, cost of doing business was going up, a whole range of screening devices were put in place. What happened to people's confidence in terms of risk? So we shocked risk premium in equity markets, and so people would be selling shares in addition to their expectation of lower profitability. They were really discounting some sectors of the economy. And then we looked at what we thought governments would have to do in terms of government spending. When we broke all those shocks down, we fed it through a global model which captured the world economy in 2003. Basic idea today is the same. The shocks, a similar set of shocks, but the impacts are very different because the structure of the world economy is very different to what it was in 2003.
I suppose it's very different because people are far more mobile. Supply chains are far more extensive. This globalization, it had only just begun in 2003 and it's far more advanced now. Is that correct?
That's right, but the bigger issue is China was a small share of the world economy back in 2003, and now it's it's equally large economy to the US. So its scale effect is very large, and it is the epicenter of this outbreak. Although it's very quickly getting caught up by Korea and Italy and Iran.
In your study, you set out 3 scenarios: a mild, medium, and severe. These are based on past epidemics. There's the Hong Kong influenza of the 1960s, there's the Asian flu in 1957, and the Spanish flu in 1918, 1919. Do you have a sense at this early stage, even though we're just a few months into it, those influenza outbreaks seem to take place over a couple years, and I suppose we're probably in the early stages. Do you have a sense of how we're tracking so far in terms of mild, medium, or severe?
Well, again, we were looking at taking what happened in terms of the case infection rates, how many people were infected in those previous pandemics, and what was the case mortality rate, that is how many people who were affected died. If we look at the moment, we're looking at an infection rate here which is well above the case fatality rate is well above what it was in the Hong Kong and the Asian flu, sitting at around 3.5%. But in terms of the number of people that have got sick, it's still a very small number. compared to the percentage shocks to the population into the Hong Kong flu and the Asian flu. It's nothing like the Spanish flu.
Right, that 3.5% mortality rate, that was released by the World Health Organization just a couple of weeks ago. Is that right?
That's correct, although that's the very early stages because a lot of very, very mild cases wouldn't be picked up, which means that it's probably lower than that, although it's hard to say. It started off at 2% in China and sat at 2% for quite a long time, on order of weeks, and has crept up over time. Particularly Iran has had very high case fatality rate, which is not surprising given the way they've mishandled the entire outbreak.
There's an extraordinary outbreak there and in northern Italy, as you well know. In your mild scenario, you suggest an attack rate or an infection rate of 10%. With 7 billion people on the planet, that's 700 million people. I'm not an economist. So that took me a while to come to that number. That's an extraordinary number. It seems almost unlikely, or is it? How would we know that we are tracking toward a number like that?
Well, again, some of these previous pandemics, you've got attack rates of up to 60%. So you've got very, very high attack rates possible. In the new study we've done, we look at attack rates of 10, 20, and 30%. I think 10% is quite plausible. And as you say, that's a large part of the world population. Bigger issue is it's a large part of the world population in very poor countries. And the capacity of those countries in terms of their healthcare, their health systems and their capacity to deal with just normal medical problems is very, very weak. And that's where the biggest risks are going to be. And the US I think has handled this very badly, and their healthcare system is very poor, actually. A lot of people don't have insurance. A lot of people won't be getting tested where they should be. There's a lot of misinformation in the system, so people are thinking that it's possibly a hoax. So what's critical in all of these cases is information is critical. You have to trust the government and you have to believe what you're being told. Otherwise, people panic, and panic is where most of the economic costs come from.
It's such an important point. Presumably, you made this study a few weeks ago, and there's been some developments since then. And you say in your study that even in a mild scenario, you could see $420 billion wiped off of the U.S. economy. Is there anything that's happened since you've crunched these numbers that make you think that do you stand by that number, or if you had a chance, would you go back to your model again?
Yeah, I think it's an underestimate now. I mean, you just have to look at what's happened to the US stock market. If you believe the stock market's reflecting the expected future economic loss, it's in the orders of trillions now. Secondly, the complete mismanagement of the outbreak by not having testing, by not screening it soon enough, and by assuming that this was an external problem that would be contained in China or contained in Libya, in Iran. That was the mistake made by the Trump administration. It is now widespread throughout the US, and that's the problem. Is they're not able to deal with it in a way you would normally manage an outbreak like this.
That's a really interesting point. There was a lot of hope that countries would be able to contain their outbreaks. How much of that feeds into this study that you've made?
Well, again, so when we in the new study, we looked at 7 scenarios. The first 3 assumed that it would stay in China, and we made different assumptions about attack rates and case fatality rates. We then thought, well, what happens if it spills across? And then we modelled the nature of the spillovers, both directly through the demand effects, but also through the people getting sick around the world. And we're already pretty much along the path of the scenario 4, which was moving towards an attack rate of 10%. Around the world, adjusted by the quality of health systems. So, for example, if we have an attack rate in China of 10%, a really well-structured economy with good government and good healthcare could probably have an equivalent attack rate of around 5 or 6%. So we try and adjust it by using a whole bunch of indicators, mostly economic, but also quality of institutions. And so it seems that we're on that path. The case fatality rate that we looked at was only 2%. And that may be an underestimate, but I think that the loss of lives is a tragedy, but the loss of economic activity is going to be extremely large.
You were saying that the United States has made some serious missteps, especially when it comes to assuming their ability to contain the virus. In your study, you suggest that even in a mild scenario, 236,000 people would die. In a severe scenario, it's more like 1.06 million. Can you explain those numbers and put them in context? Because it seems pretty jarring.
Well, it's really, again, it's just how many people get sick, and we've assumed between 10 and 30% of a population adjusted by country-specific characteristics. What's the case fatality rate? That tends to be lower in countries with better health care systems, but we looked at between 2 and 3%. You look at 30% of 3% of 7 billion people for the world, and 400 million people for the US. Those numbers are not implausible. The more you could have prevented, the more you would save, and that was the whole point of the early analysis, was to point out that these pandemics, if they emerge, are extremely expensive. And the best way to deal with them is not to wait till they hit your country, because by then it's too late. What you need to do is actually hit them at the source, which is poor countries with badly functioning healthcare systems. And foreign aid, foreign development assistance is absolutely critical. And in this world of national governments who are very nationalistic, that's the sort of funding that has been cut. And that's really exposed them to this sort of problem.
Can I ask you to speculate here? I'm sure you'd love to do that as an economist and as a scientist. Well, why is it that northern Italy is facing such a massive outbreak? It's presumably rich and has a functioning government. What's happened there, do you think?
Well, again, it all comes down to the nature of the patient zero. So in any of these sort of epidemic outcomes, you need to know who patient zero is. And once you know that, you can very quickly track their contacts, and then you can close down the outbreak. They took a long time to work out who patient zero was in Italy, and I don't know they even know now who that patient is. In Korea, they knew very quickly. It was someone that was involved with a church. So again, if you don't get patient zero, then you get the outbreak. Secondly, the healthcare system or systems in general in Italy are fairly disorganized. And so my guess is that the actual seriousness of this wasn't focused on early on. And so basically once the outbreak has occurred, it's very hard to really... It's the same sort of issue in the US. I mean, there's a lot of pockets now of states having outbreaks, and no one knows how the people who have become sick, how they were infected. If you don't know that, then you don't know how to respond, because quarantine is a very effective mechanism. And if you don't know who to quarantine, then it's a real problem.
So that then suggests that we can see many pockets of infection in the U.S. In China, it was concentrated mainly in Wuhan, for example. In Italy, it seems to be in the north. Are you suggesting that in the U.S. we can see New York, we can see Washington, we could see places in the south, and just rather decentralized rather than the centralized we've seen so far?
To me, that is because the patient zero wasn't acknowledged early on. My guess is it came through San Francisco, or at least Washington State, because that's where the most number of cases are now. But it should have been as soon as if they did testing, very high frequency testing, they possibly could have intercepted patient zero, at least very early, close to patient zero. Once it's breaking out all over the country, you've lost the capacity to respond using standard techniques which go back to the 18th century. Quarantine is very effective.
Leper colonies almost.
Well, and that's a big problem. There is a debate about whether the way they've handled the cruise ships is really the right way to do this, because you shouldn't be quarantining a whole bunch of people together with a bunch of sick and healthy people, because eventually you're going to make everybody sick. And so I think the processes have to be reassessed once we come out the other side of this.
Can you help me understand the nature of these epidemics? President Trump said, I suppose somewhat implausibly, that by April, this will miraculously disappear. There's some truth to that. It seems that the Spanish flu hit hard in the winter of 1918 and then came back again in the fall of 1919 or something to that effect. What's the ebb and flow of a epidemic?
Well, the problem you have is that you have a northern hemisphere and a southern hemisphere. So when it's winter in the north, it's summer in the south. And pandemics the diseases tend to be worse in the winter. People are more open to contracting diseases, but they're also in close spaces. And so the winter normally is when you see these emerge. Now, the idea that it's going to miraculously disappear, there are so many different climate areas in the global system, and the globe is so fully integrated that it's not going to disappear. It's going to migrate. It's going to move from the north of America to the south of America. It's going to move over space and over time. What's really critical to stop the disease has to be the development of a vaccine, and that's going to be at least a year away. So I think the president, he's not misinformed because his advisors, the scientific advisors, would be telling him the truth, but he's completely misrepresenting what is potentially going to be out there.
SARS, MERS, avian flu. There's been a number of epidemics affecting livestock. All these have been very disruptive. Now this one. Do you think the threat or the risk of epidemics and pandemics have been fully factored into economic models? So do we live in a world in which this is more the norm than it is the exception?
Well, no, it is the norm, and it's been the norm for a very long time. In 2003, the SARS outbreak should have made people realise that we needed to deal with the zoonotic diseases, the diseases that come from the animal kingdom into the human population. They were coming due to animal practices or interaction between humans and animals in poor countries. Now, that has not been dealt with. And it's not just, you've got swine flu, you've got bird flu, you've got every year or two there's been Ebola. There's a whole range of these diseases. Every year or two they break out. Mostly they're confined to poor countries, and most people ignore them. So the fact that no Americans or no French people died as a result of some of these outbreaks didn't seem to bother the Americans or the French. The point is, it's very easy for these to get out of control, which is what's happened in this case. For several reasons. One is people didn't believe it was a serious problem. They didn't understand it. They didn't want to believe it, and they wanted politics to be the driver of their decision-making processes, not listening to the scientific expertise of the epidemiologists who've been warning of this major pandemic for decades. When SARS broke out, it was we thought this was going to happen sooner, but this is going to keep happening, and it has kept happening, and they've been ignored. The science has been ignored, and that's to the loss of a lot of lives, and it's completely predictable and completely ignored.
You're from the Australian National University, and by your accent, you're Australian, I assume. There's been an awful lot of videos posted on social media of panic buying, oddly of toilet paper, or as you call it, loo paper. Are Australians right to be panicked?
We're not saying that it's not rational, but the point is, if you think everyone else will do it, then it pays for you to do it. Part of what's happening here is Australia went through a horrendous summer with bushfires, and you wouldn't have believed that you could actually be evacuated from a major city, or that you couldn't breathe for a week because the smoke was so intense. It was 10 times worse than Beijing. So people experienced very recently quite dramatic and traumatic events. And so it's quite plausible that you would say, well, I don't want to be caught out like I was during the bushfires. And if you believe everyone else is going to behave the same way, then it's perfectly sensible for people to think in their own self-interest to grab what they can grab if they think there's going to be a long period of disruption. Now, again, I wouldn't recommend it, but I can understand why people are doing it.
How much longer do you think this is going to be playing out based on what you've seen so far?
Well, there's two things playing out in the world economy at the moment. There's the pandemic, which I think could easily recycle for another 12 months. But there's also a series of bubbles in asset markets where policymakers have cut interest rates to very low levels, and asset values have gone very, very high. And all you needed was a major shock to prick the asset bubble, and you'll get the sort of effects we're seeing with share markets collapsing the way they are around the world. So there's many different problems all occurring at once, and then you have an oil war with Saudi Arabia and Russia on top of that, causing the oil price to collapse. So this is a very complicated period for this to break out, but it's not unrelated that it's going to cause all these other market adjustments, because people realise now that a lot of the valuations they've built into their financial assets were probably not close to being fundamental.
Well, Warwick, I assume that you are in high demand. Thank you very much for this.
Oh, it was my pleasure, Jeff.
And that's On the Level. Our producer is Stephen Handoko. Research by Imam Shofwan. Art by Ismi Ofa. Music is courtesy of Poddington Bear. And if you like us, share the pod with your friends. And follow us on Instagram at onthelevel_podcast. I'm Jeff Hutton. Thanks for listening.